Hi, my name is Doug Chu, and I'm a survivor of heart disease. I'm also a volunteer advocate for the American Heart Association's You're the Cure advocacy team. The next few minutes, I'd like to tell you a little bit more about myself, my experiences with the You're the Cure advocacy team, and finally, how you and I, working together, can make a difference in America's heart health. First, my story. On Christmas Day 2007, I was walking around Grays Lake here in Des Moines when suddenly I doubled over in a fetal position, unable to breathe. There was no one around me to offer assistance, and for what seemed to be like an eternity, probably really was only about a minute, I thought I was going to die. Incredibly, after that minute, breath returned to me. In a few weeks, I had a triple bypass heart surgery. I started cardiac rehabilitation, and I was on the road to recovery. I was incredibly lucky. 610,000 people die each year in America from heart disease. It is the #1 killer of both men and women. If I could have spoken during that 1 minute, when I was clutching my chest, unable to breathe, I would have said, "Please help me. I'm dying." Since I have recovered and survived, I've tried to become the person I needed that Christmas Day. Being a member of the You're the Cure advocacy team gave me that opportunity to make a difference in people's lives. At You're the Cure, we believe that advocacy plays a critical role in heart health. We advocate both at the state and at the national level for legislation that will save lives by improving heart health. In Iowa, we champion legislation that requires each newborn child to be checked for critical congenital heart disease. Think of that. Before our legislation, newborns in Iowa were tested for hearing, but not for congenital heart disease. On a national level, we fought to restore funding to the Centers for Disease Control, for heart research, and to prevent heart disease by improving standards for school lunches. I personally meet with our congressmen and our senators, both here in Des Moines and in Washington, D.C., to press for increased support for heart health. What a privilege to work on behalf of the American Heart Association and know that my voice can make a difference. But my voice is only one voice. Today, I'm asking you to join with me to make a difference for heart health. I want you to be on our You're the Cure advocacy team and work with me. I know that together we can change for the better heart health in Iowa and across the nation. Thank you.